seated. Good afternoon. I'm Kip Guy, Dean of the College of Pharmacy, and it's my pleasure to welcome you to our white coat ceremony. Students, this afternoon is for you. This event marks the moment when we embrace you as part of the College of Pharmacy by symbolically coating you. Families, friends, and loved ones, thank you for joining us today as we celebrate our new students. This ceremony is a celebration of you as well. Without your love, your support, and guidance, they would not be sitting on the stage. Students, please join me in giving your family, friends, and loved ones a round of applause. Faculty and staff of the college, I recognize your dedication to these students as they begin this journey. You keep us and them on the right track as we equip and inspire them to serve in their communities. We would not be able to provide the exceptional education that they're going to receive without you and your work. Our students could not succeed without your efforts. Students, know that we, your faculty, are rooting for you. I hope you're reminded of this support all the time. If you're a member of our faculty or staff, please stand so that we can recognize you. I'd also like to extend the college's gratitude to the broader pharmacy community, many of whom are our alumni and some of whom are in the audience with us today. Without your support and our continued collaboration, we would not be one of the top pharmacy schools in the nation. Our white coat ceremony includes both pharmacy students and graduate students because we recognize the importance of pharmacy practice in all settings, from the hospital to the laboratory, and the interprofessional collaboration between those working in the clinic and the lab towards improving patient outcomes. All of the coats our students are receiving today were donated by our gifts from our employees, students, alumni, and friends of the college. This showcases the spirit of this family and the strength of our community. This coat is a symbol of our commitment to patient care, scientific rigor, and service to our community, and also by bestowing on you our belief in you and your potential. Welcome to the community. And at this moment, I'd like to invite Frank Romanelli, our Associate Dean for Academic Programs, to the podium.
Thank you, Dean Guy. It feels like we were just here in May and kind of blinked after graduation, and here we are again for our white coat ceremony. So it's a long road ahead, but you blink and you'll be back on this stage. Our white coat ceremony is a special program that brings our PhD and PharmD students together. For members of our faculty, it is a time to rededicate ourselves to our profession. This afternoon, it is my privilege to welcome two of our dedicated alumni to the stage to speak. Our first speaker is a graduate of our PhD program. Dr. R. Kim Brazelle is a highly accomplished senior ophthalmic pharmaceutical executive with a proven track record of success in research and development, commercial management, and business development. He received his BS in pharmacy in 1975 and PhD in pharmaceutical sciences in 1980 under Dr. Harry Kostenbauer. Brazelle has made remarkable contributions to the field of ophthalmology over several decades, leading the development of innovative drug delivery approaches and enabling the treatment of back-of-the-eye diseases. He currently serves as head of R&D and chief medical officer for Keynote Pharmaceuticals. His expertise spans R&D management, global drug development, medical affairs, commercial management, and R&D activities integration. He has played a crucial role in clinical R&D, including designing unique study protocols and analyzing data to assess drug safety and efficacy. Brazelle's efforts have resulted in the approval of 7 new drug applications, an exceptional achievement given the high attrition rate for research drugs. In addition to his pharmaceutical expertise, Dr. Brazelle has also led executive management teams, and his business acumen has significantly impacted increasing revenue, drug development, licensing decisions, and regulatory approvals for the companies he has worked with. In April of this year, Dr. Brazelle was inducted into the University of Kentucky College of Pharmacy's Hall of Distinguished Alumni. Please help me welcome Dr. Kim Brazelle.
Thank you very much. It's a pleasure to be here. I haven't spoken to this big a crowd since COVID, so we do everything by Zoom now. So I'm going to pretend you're all on a computer screen, and I'm dressed like this from the top up, and then in my sneakers and sweatpants. But it's really an honor to be here to help celebrate the beginning of pharmacy education for this group, and actually the beginning of their pharmacy career. And I can assure the parents and the loved ones that you're in very good hands. I've been associated with the college for 50 years, that's hard to say, but in all that time, I can't remember a time when the College of Pharmacy was not ranked in the very top tier of pharmacy programs in the US and around the world. So your loved ones and your children are in very good hands and will have an education that's unparalleled in the pharmacy area. I'm going to try to be brief. I'm going to share a couple random thoughts that might be of interest and talk a little bit about the path that I took to get to pharmacy as a career in pharmacy school and then the career beyond that. So first I want to say to the students, look around at your classmates because you're going to spend a lot of time with them over the next 4 years. It'll be fun. At times the togetherness will be a little too much. But if you're as fortunate as I was, you'll make friendships in this group that will last a lifetime. And I have done that as well. I also want to say the education you're going to receive in the next 4 years really is, in my opinion, more broad-based than any education in the healthcare field. And it will prepare you for any of a number of variety of opportunities once you graduate. From working in the pharmaceutical industry as I did, working in academia, of course in community pharmacy, hospital pharmacy. So I urge you to keep your eyes and ears open, and as those opportunities come along, give them some thought, and I think it'll be very helpful for you. A little bit about my journey. I grew up in Western Kentucky, a small town and about as far west as you can get. And in high school, as many of you did, I worked in a pharmacy. And I learned a lot about the role of pharmacy in communities, particularly small communities. It was basically a gateway to the medical system. And the pharmacist was the most knowledgeable, most respected person in the community, and they played a huge role in that community. And in my time there, I developed a really deep interest in the science associated with drugs, how they worked, how they got to the tissues that they needed to work on. And it's a curiosity that stayed with me my entire life. Today, of course, the drugs we have are much more complex, much more broad. But back then we did have important drugs. I remember my first experience with digoxin, which is of course an old drug that's still used today. And I was really amazed how such a small tablet, and if you've ever seen it, if you dropped it, you can't find it. But how that can have such a profound effect on people, particularly people with cardiac disease, how it can improve their quality of life, prolong their life, and how if they take a little too much, it can have significant impact. And that really, for me, led to this interest that I had in learning more about how drugs work. and learning more about how drugs are discovered, how they're developed, how they go through the regulatory process, and particularly what happens once they get out to patients. So it was sort of a natural for me when it became time to choose a major. I was a little surprised when I registered at UK, they said, "What's your major?" And I'm like, pharmacy came to mind. So after 2 years then, it was a 2-year undergraduate and then a 3-year program. So I entered the pharmacy program. And after about a year and a half, I decided that I wanted to continue my education beyond the pharmacy program. And I decided to go into graduate school. My mother said it was because I wasn't ready to face the real world, and I think in many ways she was correct. But I had a couple of real mentors. I looked at a number of different universities, and I had a couple of key mentors that convinced me to stay at the college, enter the graduate program at UK. And so I was the first UK pharmacy undergraduate to go to and get through the pharmacy PhD program. After 4 or 5 years of a lot of excitement, a lot of hard work, and quite honestly, quite exhausting, I was awarded my PhD. And then I had to make the decision what career path I was going to choose to move forward. A lot of my colleagues in graduate school went on into academia, and today are distinguished professors and distinguished administrators. A number worked in government for FDA, NIH, and other areas. I chose to go into the pharmaceutical industry, and it's turned out to be an excellent choice for me. I've had the opportunity to work for some of excellent pharmaceutical companies. I've worked for some that were not so excellent, but I've had a tremendous opportunity, and I've had the ability to bring 7 products to market, primarily in the field of ophthalmology. I really gravitated towards ophthalmology, drugs to treat ophthalmic disease. So I've been blessed to be able to get 7 products through the development process, approved and to market. One of those was the first treatment for age-related macular degeneration, which fortunately I don't suffer from. One of them was for the treatment of dry eye disease, which unfortunately I do suffer from. But it was a real learning experience to get through that process. I also had the fortune to be able to travel extensively abroad. I managed a group in Switzerland for 8 years, so I was in Europe once a week of every month, and it sounds exciting, but I can tell you it not always is. And I traveled extensively in Asia, and I learned a lot about different cultures, of course, but how different cultures approach healthcare, and how different governments approach funding of healthcare. It's very interesting to look at healthcare around the world and to understand sort of the differences in how each country approaches it. So it's been a very good experience for me. I would like to say that I started out with a grand plan. I planned my life out. I had every step planned, but that wasn't the case. Most of my opportunities just came to me out of the blue. And I would evaluate each as they came based on what I knew and what my situation is, and most of the time made excellent choices. So if I can leave the students with maybe one thought, one piece of advice, is have an open mind. It's great to have your life planned out, have your career planned out, but I've found that more often than not, things don't go the way you planned them. I never did get the Nobel Prize I thought I would get when I was a teenager. But I found that those opportunities that came to me have really had a major impact on my life. So I wish you all the best of luck. I wish you all an enjoyable career. I know it's going to be hard. Pharmacy school isn't easy. Graduate program isn't easy. But I think to get to this stage, you have demonstrated your abilities and your intelligence. So I think the rest is on your shoulders. and you have a wonderful college supporting you, and I'm sure you all have wonderful careers. So thank you very much, and thanks to college for this opportunity. Thank you.
Thank you, Dr. Brazelle. Our second speaker is also from Western Kentucky. Dr. Melinda Joyce is the Executive Director of the Western Kentucky Heart and Lung Research Foundation located in Bowling Green, Kentucky. In her role as Executive Director of the Research Foundation, she oversees and facilitates all research activities, including those from students, residents, fellows, and providers at MedCenter Health. She completed her PharmD degree at the University of Kentucky in 1983. Prior to her current position, Dr. Joyce was employed at MedCenter Health, a 6-hospital health system in South Central Kentucky, where she retired in 2021 after 37 years of service. During her tenure at MedCenter Health, she possessed several leadership roles, including Vice President of Corporate Support Services, Corporate Director of Pharmacy, and she was the first clinical pharmacist at the medical center. Dr. Joyce serves as a preceptor for pharmacy, nursing, and healthcare administration students, and continues to teach advanced pharmacology for graduate nursing students at the University of Western Kentucky. She is a nationally recognized speaker who provides many continuing education programs to healthcare providers and the public. Dr. Joyce has been very active in numerous local, state, and national pharmacy and healthcare association, including leadership positions with the Kentucky Pharmacist Association, the Kentucky Board of Pharmacy, and the American Pharmacists Association. She has been recognized for her dedication and leadership to the profession with many awards, including the prestigious Bowl of Hygeia Award in 2021. Please help me welcome Dr. Melinda Joyce.
Distinguished guests, faculty, family members, and most importantly, the 2027 class of the University of Kentucky College of Pharmacy, good afternoon. I'm honored to be with you this afternoon as part of this white coat ceremony as you embark on your career as a pharmacist. Now, I'm an old dog, and in 1979, when I started pharmacy school, there was no white coat ceremony. We just went to class. So I love this. So that does mean I've been a pharmacist a long time. I've seen and been part of many changes, and you will see even more with your career. As I was thinking about today's program, in all honesty, fretting about today's program, I thought to myself, what have been some of the important lessons over my career? And I've broken that down into 3 things: opportunities, responsibility, and impact. So let's start with the opportunities in front of you. Through your education, you will learn and develop strong clinical skills. You are attending one of the very best colleges of pharmacy in the nation, so you will definitely have strong clinical skills. Those skills will then allow you to do so many things. You will learn to dose medications for every age group, recommend therapies based on a diagnosis, review a laundry list of medications looking for potential problems or issues, and how to be a key and necessary part of the medical team. And that's just a few things you're going to learn. I would also like to think you will learn how to change out a light bulb for your community pharmacy that you may own one day, but I'm not sure what class that's taught in. In all of these settings, there is one constant: the patient. And that patient depends on you and your skills. As part of your education, you will have different rotations. Take advantage of the different opportunities and step outside of your comfort zone and experience as many different practices that you can. You never know what might spark. Talk to your preceptor, talk to the pharmacist you're working with, and make the most of those rotations. While I was in the pharmacy, I used to have people who didn't really want to do a hospital rotation simply because they'd not spent time in a hospital. But when the student was open to new things, Sometimes they found out they liked the hospital environment. So look at every rotation, not as something just to complete for graduation, but as a learning opportunity. Another opportunity is to take advantage of becoming involved in your professional associations. As you heard, I've been extremely active on a local, state, and national level, and it's been so rewarding. My first association experience was actually here at UK. I was attending a mid-year regional meeting of the Academy of Student Pharmacists. And at this meeting, I saw students very engaged, drafting policy about issues within the practice of pharmacy. It was fascinating to be part of the discussions that would shape how we would practice and how policies could impact patient care. I was hooked, and I continue to be involved today. By attending local, state, and national professional meetings, I've met other students and pharmacists from across Kentucky and the country. Many of these folks continue to be close friends and mentors. The initial conversations usually started from talking about pharmacy issues, but through learning about their families and their interests, strong personal connections were made. You never know how you may be able to help one of these friends or how they may help you. Actually, I'm hoping one of them can tell me how to treat allergies. But anyway, it's pretty cool to know that you have a pharmacist friend in Oregon that you can call at any time just to say hello or to ask a question. Having a strong support system of family, friends, and professional colleagues is critical for your well-being and self-care. And it will make you even better for the patients who will depend on you. So now let's think about that responsibility to those patients and the impact. Pharmacists are often the last step before a medication gets to the patient. We must always put that patient first, no matter what, put that patient first and be their advocate. Use the skills that you have learned and take time to ask for more information or clarification to make the very best clinical decisions. Patients need you, and they need you more than ever. It doesn't matter where you work or what kind of career path you follow, because you're a pharmacist, and you will make an impact on the lives of others, because as a pharmacist, you put that patient first. Many of you will continue to wear those white coats each day. Others may trade in those white coats for scrubs, or maybe for a suit coat. You may not even be aware of the impact you're having on patients. You will have days that are hard, but you will have so many days that are so rewarding, such as when the father thanks you for spending the extra time to compound a medication for his little daughter, or when the medical resident tells you how glad that you're part of the critical care team because you understand and help with those complex medication regimens, or when you provide immunizations for your community. Years ago, when I was president of the Kentucky Pharmacist Association, the theme of my presidential year was to look for the zebra, meaning to look for those innovative ways to practice pharmacy as compared to the more customary dispensing roles. I challenge each of you to look for the zebra. Look for those ways to make an impact. Your impact will not depend on where you practice. It depends on the fact that you're a pharmacist and that you put patients first. Today is such a special day. Your white coat symbolizes the beginning of your life as part of the healthcare team. This is a time to work hard, a time to enjoy the ride and have some fun. I had a lot of fun in school, so you need to have fun. And to embrace the three important lessons that I've shared: opportunities, responsibility, and impact. Congratulations. You are on the road to being a pharmacist with patients who are going to depend on you each and every day. Your future is so very bright. Seize this time and all that is in front of you and excel. Thank you.
Thank you, Dr. Joyce. We now turn our attention to the coding ceremony. Our academic and student affairs staff, Hannah Luttrell and Jason Edwards, will take their places as ushers. While many of our students may not wear their coats in their day-to-day work, the white coat serves as a symbol to the community of our students' commitment to transforming patient-centered care as they join the pharmacy and scientific communities. Coming forward now are department chairs Dr. David Burgess and Dr. Tom Provenzano, and faculty members Drs. Penny Black and Tara McIntosh. These individuals represent the entire faculty in welcoming you into the profession as student pharmacists and scientists. Students, after you receive your white coats, Brock Hepler, Chair of the Honor Code Committee, and Thomas Vieira, Vice Chair of the Honor Code Committee, will greet each of you as you sign the Honor Code Registry. By signing the registry, you publicly acknowledge the high standards to which you are held and your commitment to reach or surpass those standards every day. This afternoon, each of you, our PhD and PharmD students, stand at the start of a long and challenging journey, and we're excited to take this first step with you. Row 1, please stand and assemble. Our first group of students receiving their white coats this evening are those students entering our doctoral program in pharmaceutical sciences. Jaylee Atkins, Rupal Arosa, Diaris Baez Maldonado, Annalisa Hahn, Lyric Lane, Sahar Mafidi, Kyler Nelson, Sol Nam, James Ojidi, Mainekia Sumit Rarachi, Eric Wallishin, Mina Yukob, Young Dijo, now we shift our recognition to students entering our Doctor of Pharmacy degree program. Eugenie Hannah Alcaraz, Olivia Allen, Rachel Avant, Kelsey Beard, Tedros B. Bowie, Catherine Bowman, Alexa Brunson. Brandon Buford. Hannah Campbell. Emily Caudle. Ashley Marie Clark. Alex Kosuranu. Hayden Cunningham. Michaela DeVore. Charleston Dixon. Claire Eddington. Hannah Edmonds. Landon Farr. Madison Geib. Katie Gibson. Lindsay Gilreath. Michael Gergovich. Colin Graves. Karen Gwandy. Bailey Hall. Elijah Hall. Mallory Hall. Zachary Hall. Ryan Haney. Caitlin Hanson. Jackson Harlan. Michael Haynes. Tenley Hibbs. Abigail Hillis. Kirsten Houston. Kristen Howard. Haley Ingram. Michaela Jefferson. Emma Johnson. Grant Johnson. Jian Jun. Erica Kellenberger. Imtithal Khalil. Reagan Knight. Jessica Quachi. June Lee. Ella Light. Sophia Lee. Darren Liu. Chantel Lole. Alexis Lowry. Autumn Matney. Elizabeth Smiley May. Emma McCarthy. David Meneses. Mackenzie Mills. Owen Minter. Allie Morris. Chandler Mullins. Griffin Nemeth. Zebediah Odango. Sam O'Keefe. Alana Ornelas. Cynthia Pearson. Riley Pleek. Alex Pollock. Emily Quatkemeyer. Nalana Redman. Gabriella Rowe. Elijah Rudd. Madison Rosillo. Brina Rayaby. Jack Ryan. Colleen Schaefer. Kenneth Schlaba. Haley Schleet. Samantha Schnaub. Hadley Shaver. Alexia Shepard. Josh Shepard. Corbin Shuffett. Whitney Simpson. Carson Sims. Abby Skinner. Kelsey Sparks. Shelby Tedder. Angeles Torres Montes. Max Ullum. Aaron Vongchan. Morgan Warren. Jamie Wells. Grant Wilburn. Asia Williams. Sarah Williams. Cindy Wu. Cameron Woodrum. Dua Yasin. Matthew Yantz. Wheel Yoon. Sally Youssef. Students, we congratulate you and officially welcome you into the University of Kentucky College of Pharmacy family. Friends, family, and faculty, I now present to you the newest group of student pharmacists and scientists. Please stand and join me in welcoming them. Please be seated. I would now like to invite Dr. David Fiola, Director of Graduate Studies and alumnus of the college, to lead the reciting of the Oath of the Scientist.
Okay. It's my pleasure to lead our new graduate students and our faculty in the Oath of the Scientist. Any members of the scientific community who are here tonight, please join us in reciting the oath. You can find both oaths in your program. So please stand. Raise your right hand and recite with me in unison the Oath of the Scientist. Throughout my career as a scientist, I willingly pledge that I will practice and support a scientific process that is based on logic, intellectual rigor, personal integrity, and an uncompromising respect for truth. I will perform my professional activities and interactions with scientific integrity and respect for the field and my peers. I will acknowledge my role as an ambassador of science to the public and strive to be honest, respectful, and unbiased when engaging the public. I will value my work and its contribution to the scientific community. I will never let the potential for personal recognition or advancement cause me to act in a way that violates the public trust in science or in me as a scientist. I will foster a community that is inclusive of all and recognize that diversity cultivates innovation, creativity, and progress. I will acknowledge and honor the contributions of scientists who have preceded me and become a worthy role model deserving of respect by those who follow me. And I will always be cognizant that my work is for the advancement of knowledge and the benefit of all humanity. By pronouncing this oath, I declare my commitment to these professional standards and goals. Please be seated. It's now my pleasure to invite Dr. Trinika Mitchell, Associate Dean for Diversity, Equity, Inclusion, to the podium to lead the PharmD students, participating faculty, and any pharmacists in the crowd in the oath of the pharmacist.
Members of the PharmD class of 2027 and faculty pharmacists and members of the pharmacy profession present in our audience, please join us reciting the oath. Please stand and raise your right hand if you are able and recite with me in unison the oath of a pharmacist. I promise to devote myself to a lifetime of service to others through the profession of pharmacy. In fulfilling this vow, I will consider the welfare of humanity and relief of suffering my primary concerns. I will promote inclusion, embrace diversity, and advocate for justice to advance health equity. I will apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients. I will respect and protect all personal and health information entrusted to me. I will accept the responsibility to improve my professional knowledge, expertise, and self-awareness. I will hold myself and my colleagues to the highest principles of our profession's moral, ethical, and legal conduct. I will embrace and advocate changes that improve patient care. I will utilize my knowledge, skills, experiences, and values to prepare the next generation of pharmacists. I take these vows voluntarily with the full realization of the responsibility with which I am trusted by the public. Please be seated.
Thank you. You've all seen healthcare professionals and scientists of all types wearing white, more specifically the white coat. Have you ever wondered why a white coat? Why not blue or red or green? History tells the story that healthcare providers' clothing and scientists' clothing often became soiled with the most obvious symbols of pain and suffering, blood. For the scientist, it also serves as a protection, a barrier against harsh chemicals and other microbes. The white coat is a flexible armor enabling curiosity, innovation, and patient care. The easiest way to remove blood and chemical stains from clothing is to bleach it, and the easiest thing to bleach are white fabrics, hence the white coat. Despite what the coat has come to mean, a symbol of authority, of professionalism, of knowledge and intelligence, at its core, the coat was intended to literally protect the wearer and absorb people's mistakes, their scientific failures, their patients' blood and pain, their suffering and their heartbreak. In this way, the coat should be humbling above all. To wear a white coat is a privilege. It sets you apart, and identifies you as a member of a community of scholars and clinicians. It represents scientific inquiry and protection. It is the uniform of a lifelong learner. The white coat offers hope. Now more than ever, our communities are looking for hope. They are asking who will perform the research to discover solutions to our problems, who will care for the sick, who will continue to guide us through future pandemics, who will always put the patient first. It will be us, the people in white coats, the coats you receive today. As you progress through your time at the college, I hope you will aspire to be the type of person who deserves to wear the coat. You should aspire to be torchbearers, bringing knowledge, compassion, and caring wherever you go. Before we conclude, just a few quick thank yous to our faculty that took the time to be here this evening, to our enrollment management team who recruited many of the students on the stage and took the time to be here, to our student affairs team for all their efforts in putting this event together. As our program concludes, our banner bearer, Dr. Robert Lotter, professor and faculty secretary, will lead our students off the stage. Audience, please remain seated during the recessional. You will have an opportunity to meet the students outside the concert hall immediately following a group picture. Thank you to everyone for attending this important event. Students, we look forward to seeing you on this stage again in 2027 when we gather for your graduation recognition ceremony. Until such time, students and faculty, you are now dismissed.